I am a publisher, writer, editor, daughter, sister, auntie, dog mom, and many other things, including currently a cancer patient. But I am not a doctor or medical professional of any sort. What you are about to watch is an episode of my journey through cancer. I'm sharing my adventure with you in hopes that you'll find something here that's comforting and maybe even inspiring. This video is not intended to provide any sort of diagnosis or treatment plan. Please go talk with your doctor for professional medical advice. Okay, it is day 67, my fourth day of treatment. And except for incredible fatigue, I have been blessedly sidestepping most side effects. Maybe. Today I felt a bit of pain for the first time, and this was in my pelvic area. Again, I don't know how to describe it. It was interior. It felt a little burning, but not anything that a little Aleve didn't take care of. I have had one true wave of real nausea, which again, I quelled that with some ginger tea, and that seemed that abated. My skin is looking a little different. It's not, I have genetically good skin, not anything I did, but it's looking a bit duller and not quite as glowy as I'm used to it looking. There is some itching, and that is mostly around, let me see if I can show you, this tape is just you want to yank it off and itch. I had another iceberg lettuce sandwich today, and the toast did feel a little as if it was making my mouth, as if it was sort of scraping areas of my mouth. So my mouth is a little tender, but knock wood, no mouth sores. And again, the hair seems to be fine. It's been untouched. I haven't combed it, washed it, done anything that I would normally do to it, in the hopes that by leaving it alone, I will be able to retain it. We'll see. Why am I skimming the side effects? This is a question I've been asking myself. You know, I really expected to feel a lot worse, and don't get me wrong, I have spent probably 22 hours of the last 4 days in bed, unable to really function. So, you know, it isn't as if I am breezing through the process, but I feel as if I have been blessed that I've been skimming some of the side effects that I was really worried about. And, you know, why is that? Well, hell if I know. Certainly not exercise. I mean, I truly have been in bed for most of the week, and I haven't done anything even slightly physical. But I'll tell you what feels good. What feels good is the ginger tea and the Zofran to keep away the nausea. That has been so good to know and so good to have ready to go. And the other thing is that is the protein. I am really, truly having 80 or nearly 80 grams of protein a day, and 70 of those, if not 80, come from protein drinks, plant-based protein drinks. And when I have those drinks, that's when I have energy. Directly following having those drinks, I feel better. The drinks make me feel better. And I guess the best way to give you an indication of how they make me feel is that I can think. I have the protein drinks and I feel as if my head clears. And that's when I can actually get a little bit of work done, is directly following the protein drinks. So those have been helping me a lot. I talked to the wonderful ladies who are my techs in the radiation arena of my treatment. And I said to them, I said, I'm feeling pretty good right now. I'm not feeling any of the effects except positive ones. I feel a lessening of the pressure in my pelvis. A little increased burning, but a lessening of the pressure. And they nodded and they said, that's pretty typical. Wait until about the end of your second week, and that's when the side effects of radiation will really hit, which are the burning around the hips and other specific areas of the body I won't go into now. But I'm giving thanks that I've had what I think is a relatively easy week, first week of treatment. I am looking so forward to getting this pump off tomorrow so that I can walk around without this bag strapped to my waist, and possibly get this, again, tape off so that I can itch. I am looking forward to showering. The excitement around showering is just palpable. And I'm looking forward to having 2 days off, no treatments, and not having to make the 2-hour round trip drive for treatment. Looking forward to not having to get in the car. And, I'm just waiting for next week and waiting for the burn. If you liked this video, don't forget to give it a like, subscribe, and ring the bell. Also, don't forget to call your senators and your congresspeople to demand universal health care, and most importantly, don't forget to vote.